AM 1220, KHTS, hometownstation.com. I am T, here with you for an hour with Dr. Proctor. Today, we're peeking over the shoulders of a medical professional, a doctor, a board-certified physician, Dr. Michael Farzam, who has a company, housecalldoctorla.com. House call doctors, not something we've seen in a very long time, but definitely a trend that is coming back for an awful lot of people who, if this is something you want in your life, it is possible now. Even before, if you did want it, it wasn't something that was necessarily available. Becoming more and more available, and is definitely the trend of the future, where a doctor will come to your home, your office, your hotel 24/7, as opposed to getting sick on banker's hours, which I have not managed to do, and I've not managed to talk my children into doing, and it's very frustrating. The other thing we're going to talk about today with Dr. Farzam is telemedicine. It's something that for a long time was a little bit of a fantasy. It was something you would see on science fiction, fantasy. Telemedicine it's a number of things now. There's telemedicine, telehealth, mHealth, which has to do with apps and mobile health. But telemedicine is one of the things. It's basically defined narrowly as the provision of medical services at a distance by a physician. Physician is, if he can't be in the room with you, if he can't be right there's a way that telemedicine is bringing the doctor to you to manage your health care kind of online or via technical issues. Dr. Farzam, hello again and welcome.
Thank you for having me, T.
Okay, telemedicine, from what I understand, I heard early on, I had learned about something like telestroke, because stroke is one of those medical maladies that, time is of the essence. Above really almost everything else that docs deal with, it's a game of minutes, seconds really. And if you have the opportunity to see a patient in the moment, well, how many of us are going to have a stroke with a doctor nearby? That's kind of impossible. And if I can't get my kids to have the flu Monday through Friday, 9 to 5, I'm not going to have grandma or grandpa or great uncle having a stroke when we're at the doctor's office. So now, through something called telemedicine, or like the telestroke, where you can have remote access to experts during the first critical time of an issue, telemedicine is now being opened up to really just about everything you can imagine, where a lot of your diagnostic skills are visual. Mm-hmm. So now with telemedicine and the way we can send information, now what are the benefits to telemedicine?
Telemedicine, a lot of the studies that have been done on telemedicine now show that, 70% of office visits don't require a physical exam to make the diagnosis, meaning the physical exam is essentially useless in the diagnostic approach to treating somebody. The simplest examples would be common cold or upper respiratory infection or bronchitis or a urinary tract infection. The physical exam for most people is obsolete, and it doesn't change the scope of how you're going to treat someone. In medical school, they always teach you 90% of the diagnosis is in the history. And what that means is asking the right question, is asking enough questions is much more important than putting your hands on the patient. And as I said, that's not true for everything, obviously.
It's not, but I can tell you from personal experience, not just my own doctor's visits, but for an awful lot of people that I've been in the role of caregiver, very often a doctor comes in, leans against the counter, talks to the patient, talks to the family, and certain hands-on thing. Not always. Maybe 70% of the time, it's the conversation. Yeah. It's looking at the file. It's exactly what you just said. It's the history. Yeah. So this can cut out, your infection proximity to a patient if they've got a cold. Telemedicine, it's sort of like Skyping with your doc.
It is. I mean, it saves time and money for everybody across the board. So it saves time for physicians as far as not having to have extra time that's spent with office staff and having people shuffling in and out. It obviously saves a lot of time for patients having to drive to a doctor's office, sit in a waiting room, go through that process, and then have to go to the pharmacy and make another trip to pick up your prescriptions. And overall, it can be just as good of care for the appropriate screening of what telemedicine is for. As I said, if someone has pain in their right lower belly, they probably need to be examined and they probably need imaging. And then so telemedicine doesn't work for every type of diagnosis.
But it's secondary. You can have that first primary.
As a screen, you got it. As a screening, or what we call a triage tool. The other benefit is, with technology nowadays that didn't exist 20, 30 years ago, we have video conferencing, we have Skype, we have, photos and everything else that can be text and emailed.
There's even your iPhone. I can tell you a personal story of a patient who actually thought they might have had a particular illness, and they had all of the hallmark signs, and they were out of town, and the doctor said, well, send me a picture and I'll let you know. And it turned out that pretty much the doctor diagnosed it from an iPhone, saying, oh yes, absolutely, that is exactly what you have.
Yeah. No, with technology, it's amazing. With photos, and we can diagnose rashes, we can diagnose strep throats, we can diagnose a lot of things that just with simple video or photos. Again,
a lot of that diagnostic tool is in the visual. There was a pilot study done that I thought was really interesting at a telemonitored a group of nurses who telemonitored vital signs of patients with congestive heart failure and then analyzed the data to identify those who needed attention. And in this study, as a result, hospital readmissions for these patients dropped 44% compared with the traditional course of care. This was like a huge part of, and again, congestive heart failure, it's not just a cold, it's not just identifying a tick bite or, what else it might be. Now, in your practice, considering doing what you do, house call doctor, is that part of your practice? And if let's say you can't get to a patient, or you have maybe a list of patients that you see normally and they travel, and instead of them going to another house call doctor or an urgent care, have you seen that in your practice where a patient will call and say, hey, take a look at this?
Yeah, definitely. We get it all the time. It's some people are traveling, so the nice thing about prescriptions, outside of making sure there's not a controlled medication, we can call in prescriptions anywhere within the United States.
And the big pharmacies, they're all connected now.
Yeah, they're all interconnected. It's nice for the patients because it saves them time. Telemedicine generally is obviously less expensive than house calls, so for the appropriate things, it actually makes sense financially for patients as well. And what you mentioned about the study about heart failure patients, particularly in the elderly population with congestive heart failure and COPD and emphysema being the number one reason people go into the hospital or get readmitted, Medicare and insurance companies now are finding that it saves tremendous healthcare dollars when these people come back over and over again every week and every month for things that can easily be triaged and managed, even with nursing care at home with telemedicine.
I think it is interesting. One of the papers that I read said that currently Medicare reimburses telemedicine services when the patient's located in a rural area, but this is opening up a whole new conversation for Medicare, saying, well, definition of rural, it's not, this, and they're now having behind closed doors conversations about, we might want to open this up to everyone, because they certainly have to see the cost effectiveness and the idea that for patients, this is an optimal bump up in their health care from what they had before. And one of the other papers I read I found fascinating is that it's the Veterans Administration. The VA is a leader in telemedicine.
That's correct, yeah.
These guys know a thing or two about efficiency, and they got on board, and they actually use telehealth services in the use of information data and to improve healthcare delivery. And a lot of people are saying that it's their work that's going to pave the way for federal policies that are supportive of telemedicine. And it is incredible to me, again, just to open up the word telemedicine a little more to telehealth and mobile apps. I have seen people, I've actually had experience where someone was having some episodes with atrial fib where their heart was out of rhythm, and they have a device that they connect to their iPhone, and with the thumb pads can send a record right then, right now, to their doctor, and 20 years ago, the idea of that would have been crazy.
Yeah. The technology has changed a lot. I mean, we can monitor people's, heart rates and rhythms and so many and temperatures and so many things with technology that didn't exist 10, 20 years ago. And it makes it, once again, doesn't replace the doctor, but
it's a huge bump up and helps you with the patient.
Yeah, and it works for all different scopes of patients, whether they are rural or living in the city. I mean, city people are just as busy and want convenience, but it does open it up to people. I mean, you can argue worldwide, you can have access to world-class surgeons and consultations in rural areas, worldwide, that don't have access to any care.
Exactly, and that would certainly be a wonderful thing. One of the other things that experts are talking about with telemedicine is the idea that, again, the affordable health care and the idea that hospitals and doctors' offices and urgent care are impacted by even more people than they ever saw before, because finally, for a lot of people, health care is an option. Mm-hmm. What this also means is, on the flip side of that, from the pros to the cons, there's a shortage of physicians and medical professionals to deal mm-hmm. with the influx of people. And one of the reasons I think telemedicine, and experts agree, I'm not alone in it, is going to be helpful in this physician shortage. Telemedicine is going to help you see more patients. Even like now, you're able to have better health care for your patients through house call. Telemedicine will open that up for you too, because you can add to your practice, and people can ultimately have better health care that they might not be able to come to see you, and then the cost savings. That overhead thing that we talked about earlier, being in an office, is you're paying to have the lights on, you're paying to have a staff, and with telemedicine, it's you and the patient.
Yeah, and I think over the next 5-10 years, the trend will change more to some telemedicine models. I think, unfortunately, right now, the insurance companies are what drives decisions, and we're trying to change that slowly, but until insurance companies pay physicians for a telemedicine visit that's substantial, right now doctors don't get paid for talking to a patient on the phone and working out their symptoms. And so what they do, whether it's right or wrong or good or bad, is they tell them to come in. And because that's the only way they can get paid is by actually seeing the patient and laying hands on them.
And that's a big problem.
And
it doesn't have to be like that.
Correct.
Because now you're taking away time also from all those other people in the waiting room, or they can't get an appointment. And this is, in the long run, going to affect everyone. And the bottom line for telemedicine is keeping people healthy and keeping them at home, keeping them where they are. The other thing with telemedicine I find to be a great benefit to patients is, let's say the expert in your healthcare for whatever issue you are dealing with doesn't live in California. Let's say they are at a clinic in the middle of the United States or another country. Mm-hmm. Telemedicine brings that expert to you, where you can have a consultation, where you can have a conversation, where the doctor can perhaps use that visual diagnostic tool, or, as you say, the records will be, because a lot of telemedicine also includes having that data, that portal that is accessible to that doctor in the middle of the country or in another country.
Yeah, it gives access to everyone. I mean, it's any way you look at it, it's better for the patient as far as having access, asking the right questions, and ultimately with follow-up, it's a great triage mechanism. And if there's something that requires more testing or follow-up or imaging, then that's what would be recommended. But it's a good starting point. It does save a lot of office visits that are unnecessary.
And we've already had some of telemedicine already in play, if you haven't thought about it. You can have primary care and specialist referral services. A lot of times that is absolutely all done, via the cyber world. Remote patient monitoring, like we were just talking about, where you can collect and send data to either diagnostic testing facilities for interpretation, whether it's blood glucose, your heart ECG, a number of indicators for these patients that can't get out of their home or their facility. You have the opportunity, I mean, medical education, how many of us have become armchair doctors on the internet and researching? And what's nice now is it's not just the wackiest of information. You can go on and look at Mayo Clinic. You can go on and look at the various medical journals online. It's kind of made some things accessible that perhaps once weren't. Networked programs, monitoring. It seems like telemedicine has so many applications, but I love the idea that in addition to the telemedicine, telehealth, something about mobile health and the fact that apps are becoming more and more of a thing. House call doctor. I mean, you're on the internet. You're part of that kind of situation. But the mobile apps now, you can put in how much you're eating. You can access how much energy you're expending by being active. I think that's a really wonderful thing for people who maybe never paid attention, to be their own health advocate. That's got to help you out.
It does. It involves patient engagement. So anytime a patient is engaged and actually actively a participant in their care, it makes everything better. So whether it's having apps that you can count your calories or see what as you said, what you're putting in versus what you're taking out, counting. I mean, there's all types of watch and phone apps now that you can count the number of steps you take per day, so you can count how many calories you're burning. It makes people more aware, and more awareness gives knowledge. And
people with high blood pressure there's an app where you can put in your readings and be a little more aware of, what times a day your blood pressure is spiking, what you're doing. Is it how you can at least be involved with a lot of your own well-being, where we didn't really have that before.
It wasn't as accessible. So I mean, now I have patients email me their trend charts for sugars for diabetics and blood pressures for hypertensives, and it makes it a lot easier, as opposed to the one reading you get in the doctor's office when someone comes in and they have white coat syndrome. So it actually does give better care for the patient overall to be able to see trends and see longer perspectives,
and more accurate and more accountable for their they can't come in and say, well, I think it was, or I'm pretty sure I wrote it down somewhere. No, it's right there.
The numbers are there.
The numbers don't lie.
Yeah.
We're talking again with Dr. Michael Farzam, who's a board-certified physician with housecalldrla.com, talking about telemedicine and talking about house call doctors and concierge medicine. If you had, and this is the future of what medicine is, very briefly, if you had in a minute to give me an elevator pitch for the one thing you want to see for the future of medicine, what would it be?
I think better accessibility to physicians overall, given the shortage of physicians that are out there now. I think the model changing over to insurance companies paying more for telemedicine services and house call doctor services is going to change better care for patients overall, as well as save money for the entire healthcare system, which is actually doing very poorly right now, and it's only going to get worse unless it's changed.
All right, so basically a sort of a kumbaya moment. Can we all just get along for the well-being of one another? I mean, it is something that affects us. There's a wonderful old saying that I've heard over and over again: if you don't have your health, you have nothing. And it's totally true. You can have all the money in the world, you can have all the power, but if you don't have your health, you really don't have anything. And the more we get on board and understand that we are responsible for one another, that would be really awesome. Dr. Farzam, thank you for joining me today on Dr. Proctor. Very happy to have you here. Again, you can learn more all about this at hometownstation.com, here on your hometown station, AM 1220 KHTS. AM 1220 KHTS, hometownstation.com. I am T, here with an hour-long program I'm doing every Thursday called Dr. Proctor. Every Thursday, noon to 1, it's an opportunity. If you don't know the word proctor, you often hear it as someone who's overseeing like a test or looking. For me, it's being the supervisor, kind of looking over the shoulder at what the medical professionals are doing, keeping an eye on what's happening in the healthcare industry, an eye on what is going on anytime you have an opportunity to speak with a doctor or advocate for your own health care. Just an opportunity to have an informal conversation about what that might look like, taking away some of the fear or some of the mystifying aspects of medicine and taking care of yourself and your loved ones. Today I had the opportunity to talk to Dr. Michael Farzam, who's a board-certified physician. Again, he's part of housecalldrla.com, which is where a doctor comes to you. Now, once upon a time, that was normal. We actually had doctors that you'd call and they'd come to the house. That's what they do. They also took chickens in payment. They don't think they do that anymore, but the whole insurance thing, it might often make them feel like they'd like to take chickens in payment for what they're doing. Doctors that come to the house will be the kind of thing you're going to see more and more in the future. One, it's a better form of health care for the patient. Honestly, it gives the doctor a chance to spend more quality time with the patient. It gives the patient more comfortable time to speak to a doctor. So house call medicine, concierge medicine, really the wave of the future. And if insurance companies can get on board, very likely something that will be available to everyone, not just a certain place with once upon a time, concierge medicine was only for the well-to-do and well-heeled, and that's going to change, I think, over time as we develop new models for what medicine is. The other thing Dr. Farzam and I were talking about was telemedicine. Telemedicine is something that is truly with us. It's here to stay. It gives the hospitals, doctors, clinicians, labs, everyone an opportunity to see a patient that might not be able to come in. Well, where that once met the patient who was rural and just could not get out to the doctor or housebound, this is now becoming more and more commonplace. You're going to see telemedicine, you're going to see telehealth, mHealth, or the mobile app health is what that's talking about. Something that's going to help the patient manage their health online through the use of computers, mobile devices. It is the wave of the future, and we're going to see more and more. And again, as the companies that keep an eye on all these things and take care of that from a financial standpoint, once they get on board, that is going to be commonplace in our homes, in our pockets, everywhere we go. If you'd like to learn more about Dr. Proctor and what it is we're doing here every Thursday, again, we invite you to go to hometownstation.com, listen to the past podcasts. There will be future podcasts here on your hometown station, AM 1220 KHTS.